Now, earlier in the day, in an exclusive interview, WION's Kalden Ongmu spoke exclusively to South Africa's Health Minister, Phaahla. Now, the Health Minister says that the number of positive cases has risen since the detection of the variant. Let's listen in.
It is considered to be one of the most, it's of a concern and most transmissible of all the variants we've seen so far since last year.
It is suspected that it may be more transmissible, but it is of serious concern, as the scientists tell us, because of the number of changes on the virus, which are more than the previous changes on this virus. So they are worried that it may be more transmissible. I think it's only in the next few days that we'll see. But let's assume that possibly their concern is correct. So it is, if that ends up to be true, that means that we really have to be worried, and we are doing everything possible to make sure that we could, implement measures to make sure that we can prevent this spreading to many more people.
First briefing, when this new variant was detected in the first briefing with you and some of the experts, you had said there were so far 22 cases. Have you been updated with the new numbers, Minister?
Well, I don't have the actual numbers, but just in terms of what has happened since then is that the number of positive cases overall have been rising. I think at that stage when we're talking, we're probably just on Thursday, we're probably just around 2,000 new infections in a day. As by last night, we crossed the 3,000. 3,200 by last night new infections. Now, in one part of the country, in the Pretoria, Johannesburg area, they did say that up to 90% of the positive cases in that area are this new variant.
Too early to ask. These the individuals that are being infected or being tested positive, are they vaccinated individuals or unvaccinated individuals? Do you have any idea on this?
Well, from as much as we don't have, very accurate data at this stage, what is coming through is that it's both. That there are people who have been vaccinated, who have been infected by the virus, but there are also those who are unvaccinated, who have also been infected.
The kind of symptoms, those individuals that have tested positive with this new variant are showing, is this similar with what we've seen before?
Again, while we don't have a clearly documented report, but as we communicate with the clinicians and also hearing from people who have been infected over the last few days, from what the clinicians are reporting, they have not reported any change. Mm-hmm. It's your dry cough, your body aches. Although some here and there you hear about not losing taste. I mean, what is it? Loss of smell. Yeah, some of them say they didn't lose their taste and smell, but they got body aches, headache. So it's within that basket of symptoms from at least what we know now.
And get to meet this challenge? Are there enough hospital beds? Are the hospitals being warned about this? Are they prepared? Are you prepared for the fourth wave, potential fourth wave?
Well, I don't think it's still potential. I think we assume that we started it already, not yet fully in it. We are not, scientific definition we have not reached. But from the experience of the last three, we are very aware of the fact that it's a matter of time. So yes, we are ready, and our readiness is along the lines of the tried and tested methods. Hospital readiness is the final stage of when everything else has failed. Firstly, we again want to increase our communication to the people to keep safe.
South Africa afford another strict lockdown, economically wise. We've seen devastating situation last year itself. Is SA ready for another hard lockdown, though? Let's be honest.
Well, I will say that the leadership of South Africa, led by President Ramaphosa, has emphasized right from last year that our balance is saving lives and saving livelihoods. We try to strike that balance. We know that it's important. The virus spreads when people congregate, when people move now, but we know also that for economic activity, you do need people to get together at work, in areas of services like restaurants, hotels, and other activities, even workplaces, in the mines, in the factories. So how do you balance this is the perpetual matter which the leaders of South Africa are trying to do all the time. So it won't be taken very easy. Any steps, any restriction on any aspect of life will not be taken easy. Only as a final, when it's absolutely required, will there be some intervention in that direction.
We'll have to ask you this, when South Africa announced this, saying that this new variant was detected, international communities, mostly the EU and some of the Asian countries, was quick to react on the travel ban on South Africa. What is your reaction on that?
Well, I would say it's quite uninformed, quite unfortunate and ill-considered because, we know that travel bans have not worked. But also the sad part of this is that, what are you saying to countries which are cooperating with, what is expected of all of us in the world as we find the pandemic? We're all expected that if we pick up a risk which can affect humanity, we must communicate through the publicly. We must not hide anything. Now, when we do that, and then you react in this manner, you actually, wanting to promote the negative. You are saying to other nations, if you pick up something, don't tell, because otherwise you're going to pay the price.
WION, now available in your country. Download the app now. Get all the news on the move.